All right. Hi, everybody. Thanks for joining us for our latest members-only webinar. I am Melanie Goldie, the CEO of Tally Health, and I'm so pleased to be with you all today. Today, we're really excited to talk with you all about the connection between restorative sleep and healthy aging. Whether you have a good time with sleep or a trouble with falling asleep, or just want to look for some tips on how to sleep better and improve that sleep quality, that's what today's discussion is about. And what's interesting is that in our data set at Tally and from our customers, we have seen just how significant both sleep duration and sleep quality are for healthy aging. So excited to dig in today. Joining me is Danny Kramer, Tally's research and innovation scientist. He'll be giving a short presentation to start off the webinar. At Tally, Danny focuses on R&D for our supplement formulations. He also helps to publish our original white papers, among other responsibilities. Prior to joining Tally, Danny had a very interesting career. He was in digital health, focusing on GLP-1s, obesity, and metabolic health. And he was a clinical researcher at Cornell, where he focused on methods development and clinical trial design for heart disease, cancer, and obesity. Danny graduated from Harvard, where he studied biochemistry and math. And then after our presentation, we'll be joined by Dr. Trinna Cuellar, who is VP of Biology and Head of R&D at Tally Health. Some of you may have seen Dr. Cuellar on previous webinars or have spoken with her. Dr. Cuellar has over 25 years of experience in biotechnology, studying aging and age-related diseases. She has held leadership roles at Genentech. She led Gotham Therapeutics at 858 Therapeutics and has been at multiple startups. Dr. Cuellar holds a PhD from the University of California, San Francisco, where she studied small modulatory RNA's role in brain development and neurodegeneration, and an MBA from MIT. At any point during our presentation, please do feel free to drop your questions in the Q&A box below. We'll be gathering those up for the live Q&A after the presentation, so please do drop those in at any point. Without any further ado, I'll hand it over to Danny.
Thanks, Melanie. Hi, everyone. So good to have all of you here, and I'm so happy to be here with all of you today to talk about Restore and all of the cool science behind it. Now I am just gonna... Hold on. All right, so you should all be able to see my slides, and I'm here to talk about exactly what you see in the title: supporting restorative sleep and healthy aging with Restore. So to start, Restore contains 3 very exciting ingredients, all of which I am going to talk about in this presentation today, and then we can get into more during the Q&A. These include magnesium, L-theanine, and apigenin, all of which have super interesting and unique biologies and effects on aging and sleep that we here at Tally are really excited to bring to all of you. So to start with magnesium, yes, that magnesium, the element on the periodic table, it's an essential component of hundreds of chemical reactions in the human body. And magnesium has been shown to do everything from increasing sleep quality to increasing natural production of melatonin, help you fall asleep faster, and even decrease restless leg syndrome. Some common foods that contain higher amounts of magnesium include nuts like almonds and cashews, seeds like pumpkin and chia, spinach, beans, soy, and pretty much most of the foods that you know of that are high in protein are probably going to have a good amount of magnesium too. And looking at some animal research around magnesium and longevity, it was shown that adding magnesium to diet significantly increased lifespan and improved health in a mouse model of progeria, which is a genetic condition that presents as accelerated aging, which was a really exciting early finding, linking magnesium to longevity and long-term health in this animal model. Shifting to some human data, a really interesting retrospective study looked at diet and epigenetic aging, trying to see if certain elements of the human diet were associated with faster or slower epigenetic aging over longer periods of time. And it was actually found, looking back over time, people whose diets had higher levels of magnesium also had slower or decelerated epigenetic aging. And people whose diets had less magnesium had faster or accelerated epigenetic aging, which was also a really powerful sign for the potential for magnesium in longevity and aging health. Looking at a little more human clinical data, this chart shows the number of individual research studies that together have shown magnesium to have positive effects on several aspects of sleep based on questionnaires and direct measurement of key sleep parameters, including increased total sleep time, decreased time to fall asleep, and reduced severity of clinical insomnia. And you can see from the numbers above each bar, how many independent studies have shown magnesium to have really positive effects on sleep across all different metrics. Moving on to our second ingredient today, L-theanine is a molecule very similar to an amino acid called glutamate. And L-theanine is so similar to glutamate, it can even mimic some of glutamate's known healthy effects, particularly in the brain. Some of these benefits from L-theanine include increasing restorative sleep, increasing sleep efficiency and satisfaction, improved signaling of a really important molecule called GABA, increased relaxation, and improved cognition and brain function, which we'll get into in the next few slides. Some foods that have higher levels of L-theanine include mushrooms, green tea, and black tea. Starting with longevity, magnesium added to diet was shown to significantly increase lifespan in worms, a really great and commonly used model organism for all sorts of diseases in humans and aging as well. Shifting to some human data, L-theanine added to diet was shown to increase sleep efficiency and decrease nighttime movement. And looking at some more human data, L-theanine was shown to boost cognition and increase relaxation. And there's a lot of bars going on here. All you need to know, the takeaways from these studies were that patients receiving dietary supplementation with L-theanine, when they were then put through some, standardized testing and cognitive assessments, the patients who were getting more L-theanine had an increase in the percent of questions they answered correctly on assessment and a decrease in the time it took them to answer those questions. So they were getting more questions correct and having an easier time answering them, which was a really good, pair of findings to see together. Moving on to the last ingredient in Restore, near and dear to my heart for reasons you will see soon. I'm excited to share with all of you apigenin. Apigenin is an active ingredient in chamomile tea and is present in many other plants and common vegetables as well, including celery, artichokes, and a lot of things you might have in your spice cabinet. Apigenin in chamomile has been shown to decrease anxiety, improve mood, and dietary intake of apigenin in chamomile has been associated with improved sleep quality. So while Tally was developing Restore, we were so excited by all of the amazing science we were seeing around all of these ingredients that for one of them, apigenin, we wrote an entire literature review exploring the biology of apigenin and published ties between apigenin, sleep, and aging. This piece was published online in March, and is free for all of you to read and share. So please, if you would like to learn more, check that out when you can. And you can see in the figure shown here from our review that apigenin has been shown to improve sleep and increase longevity through a whole bunch of different biological mechanisms. It's been shown to enhance GABA signaling, increase sleepiness, decrease oxidative stress, increase NAD+ levels, and reduce inflammation. Now looking at some mouse data, thinking more about how apigenin actually has all of the health benefits that it has. What scientists have found is that apigenin is really good at blocking the activity of an enzyme called CD38 that breaks down the known pro-longevity molecule NAD+. And if CD38 breaks down NAD+, then blocking the activity of CD38 using apigenin increases the levels of NAD+ in the body available to do all of the health and pro-longevity things that NAD+ does. So you can see on the left, apigenin decreases the breakdown of NAD+, and then as a result of that, the levels of NAD+ you can measure go up. What you see here is a chart also from our literature review, highlighting all of the clinical parameters of sleep that are improved with chamomile and apigenin, linked to all of the individual research studies backing up those findings. And putting all of this together, we can see that chamomile reduces anxiety, improves mood, and promotes relaxation. And that's all you're going to hear from me today. I could, talk about the science of Restore for hours, but we're going to just keep it at a few minutes. Just summing it up here, we've just learned about all of Restore's 3 main ingredients, including magnesium, L-theanine, and apigenin, which working together, we're excited to help give you all a better night's sleep. And with that, I'm going to pass things over back to Melanie and Trinna for the Q&A. Thanks, everybody.
Thanks, Danny. That was awesome, and really great to learn a little bit more about the literature and the science that went into the creation of our Restore formulation. So as I mentioned, we're joined now by Dr. Trinna Cuellar for your Q&A. I wanted to just start with some of the basics that have been coming up in the questions, but also just to give everybody kind of the high level again on Restore itself. So can you talk about, Trinna, the 3 ingredients again, and kind of very high level, why did we choose them?
Absolutely. Hello, everyone. Hi, I'm Trinna again, and happy to be here today and hopefully answer as many of your questions as possible. So what ingredients do we have again, and why did we choose them? So briefly, we have 250 milligrams of magnesium chelate complex. It's magnesium bisglycinate. That's what it's chelated with. We have 200 milligrams of L-theanine, and we have 50 milligrams of apigenin. So typically at Tally, we have a very rigorous process. So we go through all of the potential ingredients that we can include, and then we focus on, we have several criteria. One of them is that there is evidence in placebo-controlled randomized trials in humans that these doses are safe, that they target aspects of hallmarks of aging or healthspan, and that they extend life in animal models. So we have several criteria. And so when choosing this particular formulation, we wanted to not only help people fall asleep, stay asleep, and wake up hopefully feeling more refreshed, but also target aging while you sleep. And so at a very high level, that's why we chose those ingredients.
Awesome. And I know there are many different kinds of magnesium. Some of you in the audience may know that there are very different forms of magnesium. Can you explain, Trinna, a little bit about why we picked magnesium bisglycinate chelate complex?
Oh, yeah, absolutely. So as Danny mentioned, magnesium is essential. It's an essential element. I used to work as a bench scientist for many years. And actually, when you're setting up reactions with enzymes, you have to add magnesium to help many of them function properly. However, elemental magnesium can cause some GI distress, which is why you often see it in chelated forms. And what chelation means is it's actually just bound. In this case, it's bound to glycine. We like magnesium glycinate because glycine, we know, also extends lifespan in animal models and can target hallmarks of aging. It's actually also found in one of our other supplements, Amplify. And so you could always use a little more glycine. And so we thought, well, that would be a great form of magnesium. It's gentle on the stomach. It's, I think, one of the gentlest forms of magnesium that you can find. It crosses the blood-brain barrier, so you get those cognitive benefits as well. And, you know, all of the other numerous benefits that Danny mentioned in terms of, you know, in clinical studies showing that magnesium can decrease sleep latency, improve sleep quality, can increase natural production of melatonin to help you fall asleep. It can also activate these neurons in our body called GABA neurons, which can help calm the brain down. So many reasons why we chose it, but yeah.
That's great. You mentioned a certain dosage of magnesium. We have 250 milligrams of magnesium. Can you just clarify? There's a question in the chat here about, is that 250 milligrams of magnesium per pill? So if 3 pills are taken at 750, or it's just 250 for the 3 capsules?
It's 250 for the 3 capsules together. So certainly you can dial it down. Some people might want to start with 1 pill and then work their way up to 3, but it's 350 total. I mean, sorry, 250 total. 250 total with all 3 capsules.
Cool, thank you. And 3 capsules is the full dose. So of course you can ramp up more supplements and get, you know, start with 1, 2, or 3. Can you also just remind people of the basics on taking Restore? So is there an ideal time to take Restore? And can you take it every night?
Is there an ideal time? Yeah. So we typically recommend people take it about 30 minutes to an hour before bedtime. So before bedtime, can you take it every day? So we recommend people that are looking to improve their sleep. It doesn't seem to be habit forming. We've done safety assessments on it. So these are these are deemed to be safe doses of all of these ingredients. So in theory, you could take it, you know, daily if you'd like. And you know, there's no data to suggest that it's habit forming. Again, you know, magnesium is essential. L-theanine is found in, you know, foods as well, like green tea, black tea, as Danny mentioned, and then apigenin is found in chamomile. So
awesome. And, you know, you did mention earlier, and this has been a little bit of a hot topic, and we've gotten some questions, not just on the webinar, but from people that were happily surprised that we did not use melatonin in the formulation. So curious if you could just share a little bit more with the audience on why we chose not to use melatonin.
Absolutely. So yes, I mean, we wanted to offer a non-melatonin option that not only, again, targets aging while you sleep, but also has been shown to improve sleep parameters, not only latency, quality, and then just helping you calm down. Melatonin, as many people know, it's gotten a lot of press because of overdosing, where some supplements have been tested to show that they have many times more, you know, up to like many times more than what they're reporting on the label. So there's been concerns with that. There's also concerns, again, early days on whether it can affect puberty in young people. Early research, I think there's a lot to be done there. It is a hormone, so a lot of people want a non-hormone intervention or more natural. So L-theanine, magnesium, you know, our complex together should promote natural production of melatonin. I've seen a couple of studies showing that it may affect glucose metabolism. And so I find those really interesting. And it turns out that melatonin receptor is actually also found in our pancreas, in the islets that produce insulin. So, and 30% of people have a variant of the melatonin receptor 1B in their bodies. And it's in these studies, it's possible. What's been hypothesized and shown is that melatonin, especially exogenous melatonin, where you're getting potentially more than what your body is producing, may bind these receptors and impact glucose metabolism, not only insulin secretion, but also just in general blood glucose levels. And that's been shown, at least there's been a couple of studies, one done at night and then one given melatonin in the daytime and at night, and they saw similar effects. So I think there's a number of reasons why people may want to avoid or have an alternative to melatonin here. And so we chose to make a melatonin-free supplement.
Awesome. That's super interesting research as well. Thanks for sharing that. We do have one audience member who does take melatonin and is asking if it's okay to take the melatonin and Restore together.
Yeah, we haven't evaluated that together. I would certainly speak to your provider. I mean, certainly melatonin has been used pretty widely. There are safety studies. It's possible, but I always defer to people's providers that know their situation and what they should be taking together concurrently. It's possible you can take it together, but again, I would defer to a provider on that topic or pharmacist that can help you, because you don't want to take it and then you're too sleepy. So I would definitely just suggest speaking to a provider.
Cool. There is a Q&A here that says, I love that Tally does original research. Thank you. Please tell me more about what you found with regard to apigenin.
Oh, wow. So, that's a fantastic question. So Danny, who was just speaking, he co-authored a manuscript, was the lead author on this manuscript with Adib Johnson, another one of my colleagues who's the head of innovation at Tally. And they found a lot of really interesting things about apigenin. So one of the really cool things that Danny mentioned is that it can inhibit this enzyme called CD38 that breaks down NAD. And I think some of you may know that NAD is essential. So our mitochondria produce it. Our bodies become much less efficient at producing NAD as we get older. We know that supplementation can improve aspects of healthspan in mice and in humans. So that was pretty interesting to learn about that intersection. So they did a lot of, basically they wrote a review article where they reviewed all of the literature. Also just the clinical benefits of apigenin were, super compelling of just how it can, is associated with, reducing anxiety and boosting calm. So those were a few of the interesting things that we highlight in the review article, but I would check it out. It's a fantastic piece that they have written. It goes into much more details, and all of the study and literatures are there as well.
Great. And just a quick reminder for anybody that has a question, please do feel free to drop it in the Q&A box. We'll try to get to as many as we can today on this webinar. So I want to take a turn into discussing the effects of Restore in a little bit more detail. There's a couple questions here that relate to, when will we see an effect? So first of all, I want to ask from a short-term perspective, how soon will someone feel the effects of Restore?
In some cases, you might feel it immediately, like soon after you take it. So 30 to 60 minutes after you take it, you may feel, more calm. You might notice immediately better sleep. So you should feel the effects pretty quickly. And some people, it may be, everyone is a little bit different, but, in terms of the timing, but for many people, you should be able to see the effects right away of whether it's helping you fall asleep. And, I'm a big fan of wearables. So I also like to know, because I always wake up feeling tired. And so I want to know how well did I actually sleep? And often it's much less than I think. I might be in bed for 8 hours, but I slept 6 of them. And I want to know if it improved my sleep parameters. So I don't know. I find it very fun to track all of those sleep parameters. So I would take a look at that, but you can see it in as little as 30 minutes. So.
And then on that same line, how you and many other people like to track whether, whatever wearable device you have that tells you your sleep metrics. Can you share a little bit, Trinna, about which specific metrics are you looking at? Is it the time, the amount of time that you're actually asleep? Is it the deep sleep, or is it the REM sleep? What are you looking at when you say, oh God, this was a positive improvement?
Right. Yeah. So, there are many important aspects of sleep here. Ideally, you want to improve, you want to get adequate sleep. There was an interesting study published earlier this year where they showed that men that get adequate sleep live 5 years longer than men that don't. And women live about a little over 2 years longer, women that get adequate sleep. So we do know that adequate sleep is very important, as well as sleep quality. When you have poor sleep quality, you see much higher risk for hypertension, diabetes, obesity, heart attack, stroke, cancer, so many morbidities that you can see with reduced sleep quality as well. So I do look at all of those parameters. Ideally, I think we're going to have a cool piece on this coming soon, but certainly I do look at also the time spent in different phases of sleep. You do want to make sure that you are getting some deep sleep. About 10 to 20% of your time should be in deep sleep. Deep sleep is one of the most critical aspects of sleep, and we get less of it as we get older, right? And it's so important for our body to cleanse out toxins, memory consolidation. It's extremely critical. So that's important. I also like dreams too. So I'm not a big, not a big dreamer. So that's one of the things that, at least for a small number of people, L-theanine can also increase dreams, which I really enjoy with L-theanine. So yeah.
Awesome. Just staying on that line of thinking for a second, you made a distinction between adequate sleep, meaning the amount of time that you get to sleep, versus sleep quality.
Yeah.
And can you share a little bit more? Because I think some people may know this, but I think there are still many people who think, oh, well, I get 7 to 9 hours, which is sort of the recommended or the adequate sleep duration time, but they may not necessarily be understanding the importance of having both the sleep duration and the sleep quality.
Absolutely. I mean, there are people where, I've looked at their sleep data, and yes, they are asleep technically for 8 hours, but most of their sleep is light sleep or very restless sleep, which doesn't give us a very restorative, you're not getting all of the restoration if you're just in light sleep, moving around a lot. Lots of nocturnal wake ups can also affect sleep quality. So those are the types of things that you can look out for. If you know that some people, actually, the most common wake up time, I think, is 3:29 a.m. as of one research study that I saw, which I thought was very, very interesting. But I think people should be paying more attention to not just the amount of time you're in bed and you think you're sleeping, but sleep quality, getting really restful sleep. And I know that's hard. We have partners that wake us up. Some people have kids. I have a kid that sometimes wakes me up still. He's almost 12, but it happens. Trains, if you live in an urban environment, darkness, right? I think a lot of people don't think about darkness. We live in such a light polluted society. And I think, Melanie, one of my hobbies is astrophotography, but it's really opened my eyes to like how good darkness is for us for making sure that you get restful sleep, because light can actually also increase your risk for these diseases as well, because you're not getting, it reduces the sleep quality. So make sure you have a dark room. Avoid the blue lights if you can. I know we all like to watch screens, but some people wear those glasses. I don't have those glasses yet, but if you don't have them, I've heard really great things, because the blue light that we have can also impact our sleep. So light, dark rooms, sleep mask, big fan of darkness. So.
Yeah, these are really great tips on just overall sleep hygiene. There's been a lot of talk about sleep in the press and just in the sort of social discourse these days. And there's a lot of interesting suggestions, I would say, about how to improve your sleep hygiene, everything from, dark rooms and cool rooms and winding down to mouth tape. So can you shed a little bit of light on some of the more evidence-based sleep hygiene tips?
Yeah. So as I mentioned, darkness, that is evidence-based, trying to reduce the light. If you live in a big city, get some room darkening shades. It's super important to have a dark environment that can improve your sleep quality. Sleeping in a cool environment if you can. Again, I know some people live in hot environments, but keeping a cool in a cool, dark room has been shown to improve sleep quality as well. Again, yeah, so there's many different things. Consistent routine, right? I think a lot of us are weekend warriors. You know, we're trying to pack everything in. It's something that maybe my partner is much better at. He's always like, you got to go to bed at the same time, and I'm a night owl, so I can't help it. I am often up doing other things, up working, up thinking, but having, you know, I at least try to make sure I'm consistently doing that. So I consistently stay up late most days. But consistency is really key. That's the key to, you know, maintaining your sleep quality. Alcohol before bed, alcohol, or even
I do want to ask you about this one.
Yeah.
I want to ask you about this one. And I think that, you know, there's a question about how we know alcohol is bad for sleep, but many people actually like to enjoy a couple of drinks with dinners, maybe some wine. Are there any guidelines that you would give on how many drinks that you could have at dinner, and how long before sleep can you indulge and avoid kind of having a pretty bad impact on your sleep?
Fantastic question. A lot of that is going to be individual testing, but certainly it has been shown that for some people, any amount of alcohol can decrease your sleep quality, increase restlessness. You see drops in your heart rate variability. Certainly, I know for me, if I have a glass of wine, it does affect my sleep score. So what does that mean? Don't drink it all. I know, you know, not going to say don't have a glass of wine, but certainly do it. You know, we try to recommend if you're going to have a glass of wine, try to do it at least 3 hours before bed, because it can impact your sleep. And even then, it still may impact your sleep. If you're really curious, I definitely recommend trying to wear a sleep tracker and just see and prove to yourself the data of like what's too much for you, and limit it. I mean, certainly a glass or two a few hours before bed may not, but I would, you know, again, everyone's going to metabolize alcohol a little different. So I would, you know, try to keep it to a minimum if you're trying to improve your sleep. Because yeah, you know, I've even seen it in our own internal studies where people have marked it. I'm like, oh, yep. And my data too, I can see that my sleep scores go down, my sleep quality goes down.
Awesome. A few quick questions turning back to kind of how to take Restore and the most ideal way to take Restore. There's a question here. If I take Restore only 15 minutes before I go to sleep, will it still have some beneficial effects on sleep?
Oh, absolutely. It still can. I mean, certainly magnesium, you know, has been, I mean, all of these ingredients. So for instance, magnesium has been shown to improve sleep quality. So even if, you know, you're not feeling the benefits immediately after you fall asleep, you should feel it soon after you're asleep. Well, not feel it, but your body should be utilizing it still while you're sleeping to improve, again, you know, the sleep quality. It's improved, potentially improves total sleep time as well. It may depend on when your alarm clock is set. Some of us don't have the luxury of sleeping as long as we want, but it can improve total sleep time. It can improve, you know, insomnia scores as well. So even if you take it too late, it should still have benefits. L-theanine improves, again, these alpha waves. So, you know, you're going through cycles of sleep several times throughout the night. And so you should still see impacts on those sleep cycles as well, where you're, you know, eventually, you know, you're targeting aging while you sleep. So you could be improving. L-theanine has been shown to improve, as Danny mentioned, cognition in not only anxious adults, but also healthy adults. It was shown that it can improve executive functions, working memory, verbal fluency. You're still going to get those benefits. You're still going to get the benefits of being hopefully getting more, you know, higher quality and more restful sleep as well.
Great.
So you just might not fall asleep as fast if you take it, you know, too late.
One more question here about food. You know, we have other Tally supplements, obviously, that we provide our customers, and we recommend taking those with food. Is that the same with Restore? Do we need to recommend taking that with food or not?
You know, you don't have to eat right before taking it, but we do recommend that people eat dinner, right? So at least try that. I mean, for many people, it's not a requirement to take it with food. It doesn't need So some of our supplements we recommend taking with food because you have better bioavailability, better absorption of some of these molecules with food. That's not necessarily the case for Restore, but some people with any supplements, it's good to have, depending on the supplement, for many supplements, it's better to have something in your stomach than an empty stomach. It's less, lower likelihood of, side effects like GI. But again, we're using a very gentle form of magnesium, and we are within the limits of, avoiding adverse events. Of course, people are individuals. You might have different effects, but in general, it's a very safe, pretty gentle dose. But yeah, I would recommend eating dinner and then taking it, not an empty stomach, at least at first.
Great. We have about 5 minutes left. So if anybody else has any other questions, please feel free to drop them in the Q&A box. I just want to touch back on what your last point about adverse effects or side effects. At Tally, we have a very rigorous criteria that you alluded to earlier in the Q&A, where we, not only make sure that there's sufficient evidence that the molecules that we include in our formulations are actually shown to target health span or lifespan through multiple studies, et cetera, but we also do the third-party safety testing for the dosages. So I think that that's something that I think is important to call out when you talk about, the dosage that you and your team put in. So, and one of the questions was around that. So glad we could highlight that. I do have a couple of other ones here. So this one, it really resonates with me. This says, when my 7 or 8 hour night of sleep is interrupted by up to an hour of thinking or ruminating, et cetera, is it still considered a good night's sleep? And I personally have definitely had those nights where I wake up and, my mind is racing.
Yes. And I feel like I've read that, like, back in maybe not medieval times, but there was a period of human history where this was very common. You slept in like 2 shifts, where you had the early shift as soon as it got dark before like electricity. The second sleep, yes, thank you, Danny, for pinging me about that. That yes, the second sleep. So to me, it's more about, are you getting adequate sleep, and is your sleep quality good? And if you think both of those things are the case, you might be fine doing that. I mean, often I wake up with an idea and I'm like, oh, I'm going to write this down. It's such a brilliant idea. And then I wake up the next day, I'm like, oh, it wasn't actually the best idea, but I thought it was at the time. So I'm up thinking, occasionally I have a good idea in the middle of the night, but it's possible. I think it's definitely individual. I don't know. I'll have to look in to see if there's any studies on this particular topic, but certainly if you can prioritize, make sure that you are in total getting adequate sleep and high quality sleep, that will give you the best chances for, improving your health.
I think an audience member actually has told us that's called biphasic sleep.
Biphasic sleep.
Thank you.
Yeah.
Okay. Slightly switching to the formulation again. Is it okay to take chamomile tea in addition to Restore?
Yes, it is. It should be fine to take. I mean, you may not need to take chamomile tea with Restore. I mean, certainly we have apigenin is an active ingredient from chamomile. So you may try going out without your cup of tea, but certainly if you have a cup of chamomile, there's only a small amount. I mean, in whole chamomile, there's a small amount of apigenin. Now, if you're drinking 5 cups of chamomile, I might say maybe not. You might be getting more than enough of apigenin for your daily dose, but it's probably okay to drink a cup of chamomile with your tea. Now, I'm not a doctor, so I have to make that claim. But in general, I mean, I drink chamomile. I'm a big chamomile fan, but I try not to go crazy on it. So,
right. Okay. One other question here, also just about other supplements. Do you know of any interactions, or is it okay to take Restore while I'm also taking NMN?
I am not aware of any interactions with NMN. Again, interactions with prescription drugs, I would speak to your pharmacist on, because it's possible that some of these agents may interact with certain drug types. So I would certainly always speak with your provider. Certainly magnesium, at least from what I know, and again, I'm not a pharmacist, but magnesium can interfere with certain drug binding. So I think if you're taking magnesium and antibiotics, for example, your pharmacist may recommend, oh, you can still take it, but take your antibiotics an hour or 2 hours before or after. Now, don't quote me on those times. I would speak to your provider on your particular medication. But in some cases, yes, magnesium, and I also believe L-theanine in some cases can interact. So I would just check with your provider if you're taking other prescription drugs or other supplements. Like, don't, if you're taking other supplements with magnesium, you may want to just make sure that you're not exceeding recommended daily allowances of magnesium or any of these other agents. So I wouldn't recommend taking a Restore and taking Restore and then another drug like Restore. Like, we have set the safe doses under, they're conservative doses that have been shown to be efficacious, but certainly you don't want to, go too crazy on magnesium. I think the daily safe limit is about 350 milligrams in supplements. So.
Okay, great. And then you just said something that's interesting that was in another question that I was wanting to get to before we close. We have a few more that I definitely want to hit on. Somebody in the audience has asked, with regard to sleep aid or sleep-related supplements, would we recommend taking Restore with another sleep-related supplement such as Healthy Cells REM sleep or Stasis has a nighttime pill, regardless of the brand? I think you mentioned, whether they.
I would, again, I would check with the provider. I'm assuming that some of these, and I don't know all of the dosages and components of these other brands, but I don't know if I would recommend double dosing on these things. Sometimes I refer to WebMD, even as a scientist. WebMD is my friend, drugs.com. You may want to check and then speak to provider pharmacist about doubling up on some of these supplements, because I know some of them do contain some of the same ingredients. So you certainly don't want to, again, exceed the upper limits of magnesium, L-theanine, and apigenin. We've specifically chosen safe doses that have been assessed independently through a safety assessment. So I would definitely recommend that, and just make sure you're not double dosing on things or overdoing it. Less is more in a lot of cases, right?
Okay, great. Yeah, I mean, drugs.com is actually a great resource to look for interactions between various supplements and medications, and lots of people have talked about using that as a resource. So I think that's a good one. Two more questions about synergies. In terms of NAD plus boosting, how does apigenin compare to more direct NAD plus precursors?
Oh, that's a fantastic question. I think it's still early days to determine exactly how much NAD you are, how much of a boost that you are getting in your own personal body. Certainly, there have been studies, I believe in animal models, that have shown a significant increase in NAD, but I'm not aware of human trials yet.
Okay. Great. Just a couple of things. I did want to clarify. So there was another question here about dosage, which we talked about earlier, but for those of you who might have joined late, the dosage of Restore, a full dosage, is 3 capsules per night. But obviously, if you're new to the supplements and you just want to see how it works for you, you can always ramp up to the full 3 and see what works best. Another just clarification that has come up as well. I don't think you were recommending eating dinner and then taking it right after that, because it is going to probably start working between sort of 30 to 60 minutes.
No.
And certainly a lot of people don't eat and then go straight to bed. So yeah, so I just wanted to clarify that as well. And then another question here came up. So at Tally, we also provide our foundational longevity supplement Vitality, as well as our metabolism and energy booster, which is called the Amplify. The question is, Dr. Cuellar, do you see any potential synergies between Restore and Vitality and Amplify?
Absolutely. Yes. I mean, we, again, designed all of these supplements to target hallmarks of aging. We do know, I can't remember if I mentioned this, but, for magnesium, there's a lot of people in America, like, there are different studies, but some suggest up to 50 to 75% even are deficient in magnesium. I certainly do see a lot of synergy. So certainly you can take all three of these in a day. Again, speak with your providers as well. So I certainly, you may have certain situations. These are designed for healthy adults. But in theory, there could be synergies there. So for example, glycine, as I mentioned, we have a little bit in Restore. We also have it in Amplify as well. Those should synergize together. Magnesium can synergize well with glycine. So we do certainly see synergies, alpha ketoglutarate, the NAD boosting of urolithin A, as well as the NAD boosting of, in Restore that we potentially see with inhibiting CD38 and apigenin. Those could also synergize to hopefully increase NAD levels in your body. So I do see a variety of potential synergies through all three of these, but they're all designed to comprehensively target aging. So
awesome. All right, thank you so much, Trinna. And final question for you is about prescription-related sleep aids.
Okay.
And can you shed a little bit more light on what research or lack of research exists on prescription sleep aids?
Right. So I'm assuming if you are on a prescription sleep aid, that means that your doctor has decided that your sleep issues are severe enough that you either occasionally or continuously need a sleep aid. We do know that there are risks with sleep aids. So a lot of people are looking for, again, natural products that are non-habit forming or don't have some of the side effects that you get with some of these really strong sleep aids, benzodiazepines, for example. Like you may wake up, you better be in bed and not doing anything. And we do know that they can be habit forming. And, so yes. So, what do we know about them in terms of aging? I am not an expert on sleep, on prescription sleep drugs, sleep aids, but I do know that they can, you should seriously consider them with your doctor. If you need them, you need them. But if you can get away with more natural products or improving your sleep and by lifestyle adjustments like cool room, darkened room, minimal noise, relaxing routine, consistent routine, I think that's always going to be better for you than having to go on some of these more serious drugs that can have cause dependency and other side effects.
Awesome. Thank you so much, Trinna. And I want to thank both Danny and Trinna for being with me and on this webinar today. I hope you found it informative. And hopefully we were able to get to everyone's questions. If we weren't able to, please feel free to send them directly to us at hello@tallyhealth.com, and we will be sure to get one of our science team members to respond to you. This replay will be made available afterwards to all of you through a link in a future email to come, so you can refer back to it. And thank you all for being part of the Tally community. We are so happy to be your partner in your health and wellness journey. And again, really looking forward to seeing you at our next event. Thanks, everybody.
Thank